What are your options when the SAT is 50%? The machine's going to be flaring, your attendings or your coworkers are going to be stressing you out, the nurses, the paramedics, everyone's going to be yelling, call anesthesia. Do I have what it takes to keep this oxygenation up, to get it up higher than 50? Some of you know that I hate this dilemma, but some people are going to panic and try to intubate the patient's stat. Some people have this idea that intubation is more important than oxygenation. You know they're wrong. You know how they're wrong? You know how I know they're wrong? A SAT at 99%, I can contemplate what type of intubation I want to do. All right, what device I use, what backups, plan things out. When the SATs are 50 and they go lower, bad things happen. You start preparing for ACLS, PEA algorithms, asystole, bradycardia induced by hypoxia. All right, so what do you do? What should you do? Some people mistakenly call rescue oxygenation, rescue ventilation. If you do the same thing, basically, just use the correct verbiage. That is more important. Rescue oxygenation, so you understand what's going on. But if there's still an argument, rescue ventilation, and you know how to use the devices you need to use them. Oxygenation will not give you glory, but will keep the patient alive. Intubation, the surgical airway, will give you glory. But what's more important? Not your ego, the patient. So oxygenate the patient as much as possible. How can I get rescue oxygenation after I already failed intubation? That's important. How do I oxygenate the patient up before I intubate? So I prevent apnea, prevent hypoxic events, dysrhythmias, insults to the major organs like the brain, the heart, and other organs like the liver, the kidneys, the bowel. How do I do this? I will focus on oxygenation. How do we do this now currently? These are the options that we have. Okay? All these masks, except for one, fit and attach to our BVM, aka the handle bag, the manual resuscitator. This device is for the standard adult size. This device we'll talk about a little bit later. This is in a pediatric one, but theoretically, there are studies that have proven that you can bag someone up with their mouth closed, by you closing their mouth, by bagging them up through their nose. It works. This device looks kind of new and tricky. Looks fancy. We'll talk about it a little later. This device, you can put on the machine, connect to a machine like a BVM machine, a BiPAP or CPAP machine, or a ventilator, and put it on the NIV, non-invasive ventilation mode. This one you should not try to use the manual resuscitator, but you can if that's all you have. And use it through the port there, oxygenate the patient up. But there's uniqueness and similarities with all these face masks. And if you look at them carefully, this one has options that are similar to all these other three. 1, 2, 3. This is a PEEP valve. They should be using standard of care, in my opinion, on all BVMs for rescue oxygenation before you intubate, possibly during intubation with this device, if possible. All right. Or after you failed an intubation, but definitely during pre-oxygenation, if the patient is apneic or having agonal breathing and you're giving assist breaths. And this device is a game changer called the Supernova. Nova because it's a nasal oxygenation and ventilation apparatus. That's how Nova comes from. Designed by 2 anesthesiologists in downstate Brooklyn. And they have been using this device to oxygenate patients up during difficult intubations, failed intubations. And oxygenating them up and providing a way to oxygenate the patient during the difficult times, and hopefully preventing apneic spells and a severe hypoxia happening during intubation. All right. On this pamphlet, this describes the way you can do this full face mask. prior to intubation, nasal positive pressure ventilation during intubation. Either you're bagging the patient up with the BVM and the PEEP valve on, connected to a ventilator, set on NIV mode, or use an NIV machine, BiPAP, any other device that is non-invasive. You can provide oxygenation during transport, or provide continuous oxygenation during procedural sedation. Ruben Strayer of Mount Sinai has been mentioning this. Okay? This device be used for many things. And the one that I'm going to highlight is the nasal positive pressure ventilation during intubation. This is a game changer. But this face mask is probably going to become the standard face mask, in my opinion, for all other reasons to oxygenate a patient up. Regardless if the patient has a COPD exacerbation, CHF exacerbation, chances of apnea exposed during procedural sedation. Think about it. I'll be posting videos more about this device. I believe in it. And I will again call it the game changer. I'm not a paid employee. I'm just a fan of this device. Thank you.